Alright guys and girls, ladies and gentlemen, this is Jerningam here. We're going to see what COVID-19 Firebreak not considering at the point. In the trust, Javid depends. Cases rise. Mayor of London.
I think we should follow the same rules that we've had in this country under successive governments for decades, which is that you first would try to seek the consent of parents. So parents, we're going to ask all parents for consent. And in most cases,
but what if they don't give it, is my question.
If they don't give consent,
and children still want their vaccination.
Exactly. So if there's a difference of opinion between the child and the parent, then we have specialists that, let's say, that work in this area, the school's vaccination service. They would usually literally sit down with the parent and the child and try to reach some kind of consensus. If ultimately that doesn't work, as long as we believe that the child is competent enough to make this decision, then the child's will prevail.
So are 12 to 15-year-olds going to have jabs?
Don't know. I haven't got the advice from the chief medical officers. I would expect. I couldn't put a timeline on them. I think that would have been unfair because they've got to come to their own judgment independently.
The kids have gone back to school.
Well, the chief medical officers have had about 4 days so far.
JCVIs, of course, as we both know, have had significantly longer than that. You would have thought that you'd be able to dovetail that back into kids going back to school.
Well, the chief medical officers is who I'm waiting for now, and I want to give them the breathing space. It's their independent view, and that's exactly what it should be. But I would expect to hear from them in the next few days.
How do you feel about an October firebreak if necessary? Would you support it?
What do you mean by that?
I mean by that potentially firebreak, lockdown, whatever you want to call it, in order to, in some form or another, in order to try to stop the virus getting legs again going into the winter.
Well, I don't think that's something we need to consider.
I didn't think that last year.
Look, it is true that no one knows the future pathway of this virus.
I'm guessing you'd support it.
So I haven't even thought about that as an option at this point, because I think the decisions, as the decisions that we've made in the last few weeks, and certainly the time I've been health secretary, I think they've turned out to be the right decisions. We've shown that
we were being told to eat out to help out this time last year.
Well, I wasn't in government this time last year, so you can get a minister in that was making whatever decision I talked about. I can talk about the decisions that have been made since I've been in government, and especially around health.
It means that we won't have another wave. You're going to support a firebreak, aren't you? Obviously.
Well, no, I've just told you. I think that the policies that we followed so far, they're based on the best information, the best evidence that we can get. We listen to our experts, of course, as anyone would expect. And so when we made the recent decision to start opening up the country, to remove the social distancing restrictions, for example, and other rules, I think that's turned out to be exactly the right decision.
Well, in my opinion, it's going to be here for another couple of years. Loads of people agree, some people probably won't be. It's not going to just go away. They're hoping it's going to go away. The virus is here forever, or it could stay, or it may go. Who knows? By some miracle. Anyway, thank you for joining me, guys, girls, ladies and gentlemen. See you in the video, peace.